Hi, everyone. I'm Elaine Quijano. It's good to be with you. Thanks for joining us. This hour, President Trump is expected to hold a news conference in the Rose Garden. We will take you to the White House as soon as it begins. CBS News has learned the White House is set to announce new guidelines on national testing. President Trump discussed the plan during a call with governors earlier today. The announcement and today's briefing follow a weekend filled with tweets from the president. Mr. Trump questioned the effectiveness of the daily briefings and attacked reporters for what he says is unfair coverage of his administration's efforts. You may recall during the president's last briefing on Friday, he left without taking questions from reporters. Let's bring in Major Garrett, Ed O'Keefe, and Caitlin Conant. Major is CBS News chief Washington correspondent. Ed is the CBS News political correspondent. And Caitlin is our CBS News political director. Welcome, welcome. It is so good to see all of you. A lot to get to. Ed, let me start with you. Yes, so much to get through. So, Ed, you obtained this audio of the president's call with governors that we just mentioned. What did you actually learn from that?
Well, what we've learned is that the White House, again today, is trying to encourage the states to increase their testing capacity of people, whether or not they have COVID-19. This was a call that was arranged over the weekend after the White House tried to get a sense from governors of exactly what they might need or where they stood on their ability to test Americans across the country. And so it's essentially a document that looks very similar to the one they released a few weeks ago that had some guidelines or some tips on how to reopen the economies of these different states. The reaction of a lot of governors after that was, thanks, but this is basically what we were already doing. What this document now outlines, what the president's expected to talk about a little later, is sort of reminds everyone what the administration's been up to in terms of testing and how it hopes the states can take the lead, making clear that if need be, the federal government is there as a backstop. So is there anything terribly new or different in this? Not necessarily. There's no specific mandate or requirement or timeline laid out here, but just sort of designed to reiterate this is what the administration's done on testing. This is how many people have been tested. Here's hoping what you can do as each of the 50 states to up that. Because, of course, all the governors made clear that they really don't want to open their economies. They really can't until they have a better handle on how many people might conceivably have COVID-19.
So, Major, in addition to this announcement on testing, the White House is also shifting its focus to the economy. Against this backdrop, though, of tens of millions of Americans who've lost their jobs, what exactly is the message that the president is trying to send?
Well, that the economy can reopen, and if it's done in a gradual way that is consistent with the advice given by public health officials at the local level and at the state level, things can reopen and we can begin to see an economic rebound. But I want to talk a little bit about what Ed just said, because the document is important for all the reasons he indicated. There's now a federal commitment on paper of 2% of those in each and every state of the union being able to test their population, 2% of their population, backstopped by the federal government. That's at least a commitment by the federal government and by this administration to provide that testing capacity. Some states are way ahead of that, some aren't, but at least that's the administration putting itself on record. The other thing I think it's worth noting about this glossy sort of repackaging of administration announcements that have already existed on testing is that much of it incorporates what Dr. Deborah Birx, the White House Coronavirus Task Force coordinator, has said at many, many briefings. Why is it institutionally important that this now become a document of the President of the United States? Because the President wasn't saying those things. What was the President telling the country over and over and over again? We have all the tests we need. We're way ahead of the world. We're doing great. We're doing fantastic on testing. This document essentially underscores what Dr. Birx has always said. There's room to improve. There's more testing capacity and tests themselves that need to be performed and processed and results gathered and specific populations that need to be identified, tested, and all of that information and data warehoused and processed so we can be better capable of understanding the virus and understanding the pace at which cities and states begin to reopen their economies. Now it's an official White House document. So what Dr. Birx has said for many briefings, but the president didn't always amplify or echo or reinforce, now with a document under his name, he essentially is. I think that is important in terms of a turnstile moment for this president and this White House. And it goes to this underlying question you asked, Elaine. What is the White House messaging on the economy? Well, it's essentially a concession, in not so many words, that testing is vital to that process of safely and continuously reopening segments of the U.S. economy. Because as everyone has observed, and it's true, there's no point in reopening if everything has to double back and reverse. You want to reopen, do it safely, and do it on a consistently evolving, progressive forward pace. You don't want to have to retrench. And this document gives some of these general guidelines about how to approach that.